You're alone. The room feels smaller. A crushing weight presses against your chest like a concrete block. Your breath shortens. The clock on the wall suddenly sounds louder than ever. Tick, tick. This is not just discomfort. This is a race against time. In America, when someone calls 911 for chest pain, the average ambulance can take 8 to 12 minutes to arrive. That gap may not sound long, but inside your body, heart muscle can begin dying within minutes. What you do in that window can decide everything. We're breaking this into 6 critical survival protocols. These are not guesses. They are based on emergency medicine principles and real-world cardiac response data. Studies published in peer-reviewed journals, including the American Journal of Emergency Medicine, show that patients who take specific early actions before paramedics arrive significantly increase their odds of survival, sometimes doubling or tripling them. That is not hype. That is physiology. Let's get straight to work. Number 6. Logistics. Before we talk about medication or breathing, we talk about access. Imagine this: the ambulance is outside, lights flashing. Paramedics sprint to your front door, and it's locked. Now they have to wait for fire crews. They have to force entry. Emergency response logs in major U.S. cities show forced entry can delay patient contact by 4 to 7 minutes. In cardiology, 4 minutes is not small. 4 minutes can mean permanent heart muscle damage. The moment you feel crushing chest pressure, unlock your front door. Do not just unlock it. Open it. If there's a screen door, prop it open with something heavy. A chair, a shoe, anything. Turn on your porch light. Turn on your living room lights. Make your home visible. Ambulance crews scan quickly for visual cues. The brightest, most obvious house becomes the target. Make it easy for them to find you. If you live in a gated community or apartment building, act immediately. After calling 911, call a neighbor or building manager. Have someone meet emergency crews at the entrance. Security gates and locked lobbies create deadly delays. Remove obstacles now while you still can stand. Because here's the reality: if you lose consciousness, you will not be able to open that door later. Handle logistics first. Seconds matter. Number 5. Aspirin, the right way. You've heard it before. Take an aspirin. But how you take it changes everything. A heart attack usually begins when plaque inside a coronary artery ruptures. Your body reacts instantly. Platelets rush to the site like emergency repair crews. But instead of fixing the damage, they clump together and form a clot. That clot blocks oxygen-rich blood from reaching heart muscle. No oxygen means muscle death. Aspirin works by preventing platelets from sticking together. But here's the mistake many people make. They swallow it whole. Swallowing a pill can take 20 to 40 minutes before meaningful absorption occurs. During a heart attack, that delay is dangerous. Instead, you must chew it. Use a 325 mg non-coated aspirin or 481 mg baby aspirins. Chew thoroughly until it forms a paste. Then swallow. When you chew aspirin, it begins absorbing through the mucous membranes in your mouth. Studies show platelet inhibition can begin in as little as 5 minutes. That's a massive difference compared to swallowing. It will taste bitter, chalky, unpleasant. Ignore that. This is not about comfort. It's about survival. Unless you have a known severe allergy to aspirin, this is one of the most effective early interventions you can perform. Number 4. Nitroglycerin, if prescribed. Now we move to nitroglycerin. This step only applies if it has been prescribed to you. Nitroglycerin does not break up the clot. Instead, it widens blood vessels. Think of your arteries like highways. The clot is a wreck blocking lanes. Aspirin stops more cars from piling up. Nitroglycerin adds extra lanes so blood can flow around the blockage. It reduces the workload on your heart. But there is strict protocol. First rule: sit down before taking it. Nitroglycerin lowers blood pressure quickly. If you're standing, you may faint and fall. Second rule: place the tablet or spray under your tongue. Do not swallow it. The tissue under your tongue absorbs medication directly into your bloodstream. Swallowing destroys much of its effectiveness. You may feel tingling. That's normal. Third rule: the 5-minute loop. Wait 5 minutes. If pain continues, take a second dose. Wait another 5 minutes. If needed, take a third. Do not exceed 3 doses. If pain persists after 3 doses, you need advanced medical intervention immediately. And here is a critical warning: If you have taken erectile dysfunction medications such as Viagra, Cialis, or Levitra within the last 24 to 48 hours, do not take nitroglycerin. The combination can cause a catastrophic drop in blood pressure. You've called 911. The door is open, the lights are on. Aspirin is in your system. Nitroglycerin has been used correctly if prescribed. Now comes the phase most people underestimate. This is where physics and physiology collide. What you do with your body position and your breathing in these next several minutes can either reduce strain on your heart or quietly make things worse. This is where calm action becomes a weapon. Number 3. Posture. Reduce the load on the heart. When chest pain strikes, many people instinctively lie flat. It feels natural. You're weak, dizzy. You want the floor beneath you, but lying flat can increase pressure on your struggling heart. When you are flat on your back, gravity distributes blood evenly throughout your body. That sounds helpful, but during a heart attack, it increases venous return to the heart. That extra returning blood volume stretches the heart chambers. Cardiologists call this preload. Imagine your heart as a pump already fighting to push blood through a partially blocked pipe. Now imagine forcing even more blood into it. That stretch increases workload. A damaged heart does not need extra strain, it needs relief. That is why positioning matters more than most people realize. The goal is simple: reduce workload, improve oxygen exchange, prevent sudden collapse. Here is the correct position. Sit on the floor, not on a chair. If you faint from a chair, you risk head trauma. Sit on the ground and lean your back against a solid object. A wall, a couch, a sturdy bed frame. Elevate your torso at roughly a 45-degree angle, not fully upright, not flat, controlled and supported. Stability is critical. Now bend your knees and place your feet flat on the floor. Your body should form a loose W shape when viewed from the side. This posture accomplishes two things. First, it allows gravity to keep a portion of blood pooled in your lower body. That slightly reduces the volume returning to the heart. Less volume means less strain. Second, it opens your chest cavity. When you lie flat, your abdominal organs press upward against your diaphragm. That makes breathing harder. When you are semi-seated, your diaphragm can move more freely. Your lungs expand more efficiently. Oxygen delivery improves. During a cardiac emergency, oxygen is everything. Every breath must count. This position helps make each breath more effective. If you begin to feel lightheaded, stay seated. Do not attempt to walk. Do not try to push through it. Movement increases cardiac demand. Your mission right now is conservation. Think of it like placing your heart into low-power mode while waiting for advanced support. Controlled stillness becomes strategic. Number 2. Breathing. Override the panic loop. Now we address the invisible threat: panic. The moment severe chest pain hits, your brain triggers the fight-or-flight response. Adrenaline surges. Your heart rate increases. Your breathing becomes rapid and shallow. This is called hyperventilation. It feels like you are gasping for air, but in reality, you are destabilizing your system. Hyperventilation lowers carbon dioxide levels in your blood. That causes blood vessels to constrict. At the exact moment your heart needs maximum oxygen delivery, panic narrows the vascular pathways. You are unintentionally making circulation more difficult. This is why breathing control is not just calming, it is physiological intervention. You must manually override your nervous system. Engage the parasympathetic response. Stimulate the vagus nerve. This nerve acts like a brake pedal for your heart rate. When activated, it helps slow the heart and reduce stress signals. You can trigger it with a specific breathing pattern. Here is the technique. Inhale slowly through your nose for 4 seconds. Expand your abdomen, not your shoulders. Let your belly rise. Hold that breath gently for 2 seconds. Now exhale slowly through pursed lips for 8 seconds, like you are blowing air through a thin straw. The exhale must be longer than the inhale. That ratio is critical. When you extend the exhale against slight resistance, you create positive pressure in the chest. That pressure stimulates vagal tone. The result is a gradual slowing of heart rate and a reduction in sympathetic overload. It is not instant magic. But within minutes, it can stabilize rhythm and prevent escalation. Focus only on the count. 4 in, 2 hold. 8 out, repeat. Do not rush it. Do not force it. Your goal is rhythm. Controlled rhythm creates neurological stability. Neurological stability protects cardiac function. You are not just calming yourself, You are protecting oxygen delivery pathways. Many cardiac survivors later report that controlled breathing kept them conscious until paramedics arrived. Panic accelerates damage. Control preserves time. You cannot eliminate the clot. You cannot reopen the artery yourself. But you can prevent additional stress from compounding the crisis. Stay in position. Keep breathing. Keep the cycle steady. Your only job right now is stability. Number 1. The time stomp. Protect your treatment window. Now we reach the final pre-hospital survival move, and almost no one talks about it. Hospitals use powerful medications called thrombolytics, sometimes referred to as clot-busting drugs. These medications can dissolve certain clots and restore blood flow, but they come with serious bleeding risks. Because of that risk, doctors must follow strict time guidelines. They need to know when your symptoms began, not approximately, not earlier tonight. They need an accurate time of onset. If you arrive confused or drifting in and out of awareness and cannot provide that timeline, doctors may be legally unable to administer certain treatments. The window could close. The moment symptoms begin, note the exact time. Say it out loud to the 911 dispatcher. Write it down if you can. Send it in a text message to a family member. Anything that creates a time stamp. That information may directly influence what life-saving interventions are available to you in the emergency department. If symptoms started at 7:42 p.m., say it clearly. Repeat it. Make sure it is documented. This is your medical data anchor. It protects your eligibility for advanced treatment options. That single piece of information can alter your entire hospital course. You have now built your survival buffer. Access secured. Aspirin active. Nitroglycerin used properly if prescribed. Body positioned strategically. Breathing controlled. Time documented. You have transformed passive waiting into active defense. The sirens are getting closer. You've done everything right. The door is open. The lights are on. You're seated in the W position. Your breathing is controlled. Aspirin has been chewed. Nitroglycerin has been taken properly if prescribed. The time of symptom onset has been documented. Now comes the final stretch, and this is where discipline still matters. When paramedics enter your home, their first priority is speed and assessment. They will move quickly. Wires, blood pressure cuff, oxygen, questions. Do not panic at the intensity. This controlled chaos is precision. Every second they are gathering data that shapes your survival pathway. Stay seated unless instructed otherwise. Do not attempt to stand up and show them you're okay. Sudden movement can cause your blood pressure to drop sharply. If you faint while standing, you create an additional emergency. Let them come to you. You have already done the hard work. The first thing they will likely do is perform an ECG. This measures the electrical activity of your heart. It tells them whether you are experiencing what is called an street elevation myocardial infarction, a severe type of heart attack that requires immediate catheter-based intervention. In many parts of the United States, paramedics can transmit your ECG directly to the hospital while still inside your living room. That means the cardiac team may be preparing before you even arrive. Time is muscle. The faster blocked arteries are opened, the more heart tissue is saved. This is why your early actions matter so much. Now let's talk about critical mistakes people make during these minutes. Mistake number 1. Driving yourself to the hospital. Do not do it. If your heart rhythm becomes unstable while you are behind the wheel, you could lose consciousness and cause a fatal crash. Paramedics carry defibrillators, oxygen, 4 medications, monitoring equipment. Your car does not. Emergency transport is not just about speed, it is about protection during transport. Mistake number 2. Minimizing symptoms. Many Americans, especially men over 50, delay calling 911 because they don't want to make a scene. They wait. They Google. They sit quietly. They hope it passes. Every minute of delay increases heart muscle damage. Pride has no place in cardiac emergencies. Action does. Mistake number 3. Ignoring atypical symptoms. Not all heart attacks feel like crushing chest pain. Some present as jaw discomfort, arm pain, shortness of breath, nausea, profound fatigue. Women, in particular, may experience subtler symptoms. If something feels dramatically wrong and you have risk factors, treat it seriously. Early response saves lives. Now let's talk about what happens at the hospital. If your ECG confirms a major blockage, you will likely be rushed to the cardiac catheterization lab. A cardiologist will insert a thin tube through an artery in your wrist or groin and guide it to your heart. A balloon may be inflated to open the blocked artery. A stent may be placed to keep it open. This procedure restores blood flow rapidly. The difference between a 30-minute delay and a 90-minute delay can mean the difference between a stunned heart and permanent damage. And remember that timestamp you recorded? That becomes part of your treatment algorithm. Certain clot-dissolving medications are only administered within strict time windows. Your clarity during those early minutes can expand your treatment options. But survival is not just about what happens during the event. It's also about what happens after. If you survive a heart attack, your lifestyle becomes your next battlefield. Smoking cessation, blood pressure control, cholesterol management, diabetes management, cardiac rehabilitation. These are not optional suggestions. They are structural reinforcements for your future. In the United States, heart disease remains the leading cause of death, but survival rates have improved dramatically over the past decades, largely because of faster recognition and faster intervention. The biggest variable? Time. Let's recap your 6 survival protocols. Number 6. Unlock and open your door. Remove barriers. Number 5. Chew 325 milligrams of non-coated aspirin unless allergic. Number 4. Use prescribed nitroglycerin properly, seated, under the tongue, maximum 3 doses, never mixed with erectile dysfunction medications. Number 3. Assume the W position, seated at 45 degrees, knees bent, feet flat. Number 2. Control your breathing. 4 seconds inhale, 2 hold, 8 seconds exhale. Number 1. Record the exact time symptoms began. That is your pre-hospital survival blueprint. No panic, no guessing. Just structured action. Now, a critical reminder. This video is for educational purposes only. It is not medical advice and does not replace professional diagnosis or treatment. Always consult your physician about your specific health conditions, medications, and risk factors. If you suspect a heart attack, call 911 immediately. Do not delay seeking emergency care based on any video content. If this breakdown brought you value, share it. Someone you care about may one day be alone when symptoms begin. Information is preparation. Preparation is survival. Thank you for watching. Stay aware, stay prepared, and stay strong. We'll see you in the next video.